When deciding between using your own eggs or eggs from a donor, what factors might a woman consider beyond their age alone?
Well, I think the number one factor is not age. It's a calculus of what are my chances of success. And then you have to factor in next, what is most important to me? Do I want my child genetically, or do I just want a child? And then you need to determine how many children you want. I think that's critical as well. And then you need to look at your finances. And this is issuing the importance of moral decisions with how you feel about donor eggs and potentially extra frozen embryos and so on. But those are important as well. But I think the initial factors are the most important, because I can sit with a patient who is, let's say, 50 and tell them it will likely take them in excess of 10 rounds of IVF for them to get a very low chance of success that they would walk away with a live birth. And that's probably going to cost them, even in the cheapest scenario, well over 100,000 Canadian dollars. And that's not including all of the time, the frustration, the emotional burden, the trauma on a relationship. And all of those things are important for people to consider, or they can do one round of donor egg and have, in excess of 3 children with a greater than 90% success rate. So I think patients need to understand the calculus. If you're 40, we have a very good chance with you. If you're 43, we still have a reasonable chance with you. If you're 45, it starts getting more difficult. When you're approaching your 50s, it's very challenging. And so people need to know that calculus and then make a decision that's fitting or appropriate for themselves. We don't push people into treatment with our practice. We inform, we educate, and we support. And I think that's probably one of the biggest things that's missing from the fertility world. We talk about transparency, but you can only offer transparency after you've educated, informed, and then provide support. The transparency comes in terms of offering people that educational component, the informational component. But when you are offering people advice, you have to give them what are the numbers for their specific circumstance. What's it going to look like if they do it naturally? What's it going to look like if they try IUI? What's it going to look like if they do IVF? And what's it going to look like if they do donor egg? It's up to the patient to decide what's right for them. You may decide that for you, donor egg is never in the cards, and you're willing to throw your life savings into trying for you because that's what's most important to you. Great, that's what's right for you. We're going to create a protocol that fits your needs. Other people might say, I don't want to invest my life savings into this. Give me a more, financially value-oriented approach. That's going to be IUI or doing donor egg. So there are different options for different people, and they need to be informed about that so they can make a decision that's patient-centered and patient-specific.